Hospitals are the front lines at infection control, and you would think they'd be among the most sanitary of places. Well, you'd be wrong. Joining us now for more on how clean our hospitals truly are, U of T professor Colin Furness, who is an infection control epidemiologist at Infonaut. And Colin, it's good to have you here at TVO. How you doing?
Very well, thank you.
Well, you study this stuff. What did you basically try to find out?
Well, hospital-acquired infections and infections in hospitals in general are a really vexing problem. They're not going away, despite a lot of money being thrown at them. So we tried to approach the problem with better measurement. If we could figure out what was going on, could we actually devise better ways of preventing or controlling infections?
So how do you find out what's going on?
We attached transponders to staff and equipment and patients so we could actually track them moving around a hospital. And we tracked a number of different things, sort of a big data approach, if you will, to understanding what's going on and trying to find patterns that are meaningful. And we discovered toward the end of the pilot that it was patient hand hygiene that stuck out as something that was particularly weak and probably represents a serious risk for hospital patients.
Did you have to put transponders on people because if you relied on them just to tell you, they'd lie?
Yes, there are studies in the literature on self-report, and sure enough, people coming out of the bathroom will assure you they wash their hands.
And they have not.
They have not.
Yeah. Let's look at some of the numbers. Sheldon, if you would, we're going to put these up. This is patient hand hygiene compliance as done through your study. Now, how about, let's just look at the bathroom. Is this, are you telling me fewer than 30% of the people wash their hands after going to the bathroom in a hospital?
Yes. It's a little bit higher for women than men, as you might expect,
yeah,
but it averages out to 30%. Work that I've done subsequent to that shows that visitors and hospital staff have about a similar performance. So 30% seems to be a bit of a magic number for private bathrooms.
All right, let's try meals here. If we put up the numbers for meals, once again, after meal, fewer than 40% of the people are washing their hands. For breakfast, it's less than a third. For lunch, it's almost 40%. And for dinner, it's almost half. And let's do one more set of numbers here. How about just sort of leaving a room? 2.9%. Sorry, that's entering a room. And leaving the room, 6.7%. All right, let's go through this a little bit. It feels like those numbers are really low. Is that what you'd say?
They're low, and our mealtime numbers may well be an overestimate just in terms of the way we actually did that measurement. It's easy to know when someone's going to the bathroom. It's harder to know when they're having their breakfast or lunch. So we certainly tabulated it in favor of the patient. We don't know why it's lower in the morning than the afternoon, but there is a significant difference there.
You know why it's lower for men than women, other than we're pigs and they're not? Well,
I think that's a big piece of it, no question. Just anecdotally talking with men and women about this, we find men in an honest moment will say, yeah, they're lazy. They will use hand sanitizer more than soap. So that's consistent with being lazy, but maybe not entirely reckless. Women use a lot more soap than men do. They use less hand sanitizer. When we talked to women about that, what we found again and again was the notion that hand sanitizer dries out your hands and therefore you'd want to avoid it. Huh. And what's interesting about that is, in fact, it's the reverse is true. Soap is designed to strip oils from your hand. Good hand sanitizer has moisturizers and actually won't do that.
And just for the record, are you supposed to do one or the other or both?
You're not, both is not recommended, one or the other. Hand washing is said to be the best when it's done properly, but that's row your boat twice while you're washing, and I've almost never in my life seen anyone do that in the course of daily life. Hand sanitizer has some advantages because you don't need to be as careful, and it stays on your hands. There's a residual there, and you get some residual protection too.
The fascinating thing about these numbers, of course, is that if people are wearing those devices on their hands, they know they are being watched, and presumably would therefore pick up their game knowing that you're watching them, but it does not appear to have taken place.
We didn't tell them we were following them to the bathroom explicitly. At the time we attached them, that was not the plan. So with we did this retrospectively, and so we were not expecting therefore a Hawthorne effect. But to the extent that they may have been aware, they may have upped their game. 30% may be optimistic.
Hawthorne effect is what?
Sorry, the Hawthorne effect is the tendency to change your behavior when you're being observed. So we also did a study in the same pilot where we looked what happens when an auditor shows up on the hospital floor, and staff consistently triple their hand hygiene rate when they're in line of sight of an auditor. As soon as they turn the corner, it drops right back down again.
That is so typical, isn't it? You touched on this earlier, but let's see if we can flesh this out a little bit more. Staff versus visitors of hospitals. Dramatic difference in how much they wash?
Well, staff are given set rules, and they do follow them to some extent. Visitors are rarely told anything about anything. And if you stand at the entrance to a hospital and watch the big bank of hand sanitizer dispensers, you can spend an hour before you see them used once. So there's no guidance, there's no signage, and so on and so forth. So a hospital we're working in now, we actually experimented with putting signage in a visitor lounge, and we were able to notch up the hand hygiene slightly.
Okay, I don't get that, because you walk into any hospital, you are going to see, as you point out, the bank of the hand sanitizer stuff, and you are going to see signs. And you are going to see signs saying, do this on the way in and on the way out.
Yes.
What don't people get about that?
Well, I think the signage is secondary to social cues. If no one is doing it, then no one does it. So it's almost like lemmings. If the first person did it, perhaps everyone else would. But the default behavior is no, not in, not out.
Our homes are filled with cleaning products.
Yes.
And yet somehow when we go to a hospital, we somehow let our guard down. How does that make any sense at all?
People are very irrational, I think, in many ways, but certainly with respect to things they can't see. So you're more comfortable in your own home, you've got a routine and so on and so forth. A hospital is a very scary place, and that can have all sorts of unpredictable effects on behavior. It can inhibit. I'm frightened when I walk into hospitals. I try not to touch things because I think about this stuff.
Of the germs that are there?
Yes.
Okay. What does the science tell us about whether you ought to be frightened?
Well, bugs that you have in the house are typical garden variety often. They come from you. You obviously want to be careful in the bathroom when you're doing food preparation, but apart from that, homes are fairly safe places. Hospitals breed antibiotic-resistant bugs, which means if you happen to inhale the wrong kind, you could be in a lot of trouble.
Should you actually not go to a hospital to visit anybody if you had your druthers?
I'm not sure I would be that extreme about it. I would just be extremely careful. Don't touch things, don't touch your face, clean your hands.
Have hospitals always been very hostile environments for germs?
It's gotten worse since about the mid-1990s, much worse. But first antibiotic resistance was detected way back in the mid-1960s.
1960s, okay. Let's do the calendar watch then. 1990s, something happened in order to make it a more virulent place? What happened? I'm
not sure it's a single event. It's really just that it started to get noticed more and more. Clostridium difficile, methicillin-resistant staphylococcus. These are nasty, dangerous bugs, and
C. difficile and MRSA, as we call them.
Yes,
okay.
They're very, very nasty bugs, and they just started to show up in greater numbers.
Okay, we've already talked about what happens if you're a visitor. You walk in. Hopefully, you're a lemming. You'll wash your hands like everybody else. Doesn't. What about hospital staff? Are they really put through their paces in terms of, here's what you need to do, now do it?
This is a problematic area. The World Health Organization and the U.S. Centers for Disease Control have a protocol. In the States, it's 5 moments, exact moments that before patient contact, during patient contact, when you get stuff on your hands, after patient contact. In Ontario, we shrink it down to 4 metric. But the point is that you're told very specifically when to clean your hands. And staff do a reasonable job of that a lot of the time, a poor job a lot of the time. But I think the big problem here is that those moments actually miss the point. They miss the point that hands are supposed to be clean. So those moments, staff are not instructed to clean their hands when they go to the bathroom, because that's not one of the moments. They're not given a lot of training or education in not touching things, not recontaminating their hands afterwards. So there's so much that they're not told. There are millions of dollars spent on enforcing or trying to enforce compliance at these very precise moments. But that doesn't seem to give us clean hands. And all of this effort has not yielded any reduction in hospital-acquired infections.
I presume, but I shouldn't, of course, that doctors do scrub up intensely before doing any surgery.
Yes. Surgery, operating rooms are extremely clean environments, and the protocols for doing hand cleaning there are intense and followed very, very carefully.
So that is not the issue?
Not the issue at all. It's just patient rounds. It's patients in their rooms and their beds.
Is it, like, I want to know who the offenders are. Are we talking doctors, nurses, orderlies, dietitians? Who are the worst offenders here? Well,
doctors are usually, the finger's pointed at them as being poorest for hand hygiene compliance, but they're also much less likely to actually touch a patient. They're less likely to need it. Nurses are doing the most touching, so they have the biggest impact one way or the other. And then there's a whole range of allied health that may have direct patient contact or not. The amount of touching really gets down to it.
Anything can be done about this?
Well, I think public education. If I had to point to one thing, I would say if we all just had a better understanding of our relationship with bugs in the environment, and just behaved a bit more rationally, shook hands less, touched things less, were just a little bit more cognizant, based on education, based on acting smart, then I think we could do a better job.
But that's the public. How about people who work in the healthcare system, who work in hospitals, who ought to know better, who are currently not complying? How do we get them to comply more?
Well, there's been a lot of effort done in terms of educating the group, in terms of doing all sorts of training, other kinds of interventions. Nothing has really proven very successful. We're doing some work now on what I would just call behavior modification, designing the environment to encourage hand cleaning rather than asking people to do it. So putting that hand sanitizer dispenser right in the line of sight, for example. Signage that might be construed as a bit frightening or a bit aggressive, to really make people think, to make it harder to ignore. So there's ways, I think, in terms of what I would, as I say, call behavior modification, that could help.
I suspect in a place like Toronto, you'd probably want to have signs in many languages as well. Is that something anybody's doing?
I have not seen that.
Neither
That's
have
an
I.
excellent point.
Huh. I think you mentioned earlier that when auditors follow people in the hospitals, compliance goes way up. Should we spend more money to hire more auditors?
Well, you'd have to have almost an infinite number of auditors, and again, it's a very temporary effect. So the auditor would have to actually follow you into the patient room, which is currently not what happens. Auditors hang out in the hallways where the patients are not. And auditors are counting hand hygiene behavior that isn't really in the line of patient care. So auditors, like police speed traps, get people to slow down temporarily. You'd have to have one of those, every few meters in order to actually have a desired effect. So I don't think it's cost effective, and I've never heard anyone suggest it is cost effective.
Okay, one last question before we get everybody else out here, and that is, again, so much of this is sort of culture and social cues and that type of thing. Is it appropriate if you're a patient or a family member of a patient in the hospital to actually say to your doctor or nurse before they treat you, could you please wash your hands? Let me watch you wash your hands.
I think that would be great. There's just a lot of social mores around not having that conversation. There's been a lot of research asking whether patients will interrogate their caregivers. Will you wash your hands, doctor or nurse? And it turns out patients don't want to do that. Yeah. If you're nasty to your waiter, they'll spit in your soup. Imagine how you feel about your doctor when you're sick in bed.
That's the point.
There's been very little work in terms of getting staff to ask patients, and none that I know of in terms of staff to ask visitors. So I think that's something where we might actually see some gains.
Support Ontario's public television. Donate at tvo.org.